Hello, my name is Yuz Yusof. I'm reporting for Room Now. I'm from Leeds, United Kingdom. Today, I would like to discuss an abstract that I found interesting and will be useful in our clinical practice. This abstract is also quite thought-provoking. So the abstract title, the number is 1463. So this abstract was presented at the press release SLE as well. So this is a study about trying to evaluate the outcomes of patients who do not have lupus nephritis, but were found to have low-grade proteinuria. So what happened to them? Whether do they progress into full-blown lupus nephritis, or did they get better naturally, or did they remain stable on its own? So the several guidelines from different countries have different cutoff. I think in America, the cutoff for a renal biopsy is if persistent proteinuria of more than 0.5 gram. And that probably indicates biopsy, whereas other countries may vary. So in this study, so they look into 151 patients who had between low-grade proteinuria between 0.2 and also 0.5 gram. So they then look into the outcome at 2 years. So what they found, there were a split 50%, 50%. 50% of the patient, they call it progressor. So whether these patients then progress to urine proteinuria of more than 0.5 gram, whereas another 50% remain the same or become normalized. So of these 50% who progress into more than 0.5 gram per day proteinuria, so what they found, there were two types of phenotypes as well. One, they called it the fast progressor. So basically what happened, so these patients progress really fast to 0.5 within 2 years, and whereas the other one is slow progressor. So they progress to a cutoff of 0.5 and above is more than 2 years. And what they found that they also did kidney biopsy. So 16 out of 20, so 80% of the people who were fast progressor will actually have a biopsy positive lupus nephritis that required some treatment. So overall, the rate of positivity of renal biopsy were 11%. So therefore, what does this study tell us? So this study actually reminded us that low-grade proteinuria may not necessarily be benign. So I think if we do see this in the clinic, for instance, if we do a urine dipstick and there were like a 1 or 2 plus, I think what we should do, we should quantify them. And if it's not normal, and if it's and it was taken correctly, for example, it was not taken during the patients had a water infections or during the period, I think what we should do, we should aim to monitor this proteinuria. Because half of the patients potentially could progress into spiraling up the level and also progression to lupus nephritis. So I think this is really it's an important studies. Also, this study also provide like a framework that maybe we also need a better biomarkers in this group, which could be considered as at risk to progress into kidney disease. So I hope you find my summary useful, and thank you for listening, and I hope you continue to follow our coverage at Room Now through YouTube, LinkedIn, and also Twitter. Thank you.